Back now on this special edition of Triad Today, and with us a guest who's been with us before, and we always like to have her here in the studio with us. J. Paul, Director, if we can see. Sheila Jones, she's Director of Marketing for Mountain Valley Hospice and Palliative Care. The headquarters is, in Dobson, the Mount Airy area?
In Mount Airy.
But you are everywhere. I mean,
we are.
Where all do you serve?
We are serving a 16-county area in North Carolina and Southern Virginia.
Right.
Surrey and Yadkin County and anything that touches Surrey and Yadkin, and then Carroll, Grayson, and Patrick County in Virginia, and anything that touches those counties.
And you just opened a new office in Pilot Mountain, is that right?
Yes, we did. We were growing and needed some more space in Mount Airy, and it just made sense to add an office in Pilot Mountain to better serve those folks in the Stokes County, Forsyth County area. We were able to also help out some employees who were serving those patients already in that area, and we made their home base in Pilot and helped them out.
That makes sense now,
so
because you try to put... You've got a whole bunch of offices now throughout the region, which makes it easier on staff to serve.
We have seven, yes, seven locations.
7 locations. Now, before time gets away from us, we've done segments with you before on hospice, but you can't ask this too many times. Give us a thumbnail sketch of what is hospice, because I don't want people to wait and say, well, I didn't know about it, I didn't know when I should ask for help from my family or whatever. What is hospice? What does it do? We
provide care to anyone who have a terminal illness. If there's something where the physician says they have 6 months or less, or even 8 to 10 months, it's never too early to contact us. No matter what their disease or if it's cancer or heart disease or whatever it may be.
My dad passed away from COPD, which is a lung disease, and of course he just had great care through hospice and palliative care.
Right.
And, not that I was going to do a commercial for it, but
it's simply, very easy. If you're not sure if your loved one is ready for hospice, just call us, and someone can come out and evaluate them. There's no cost to the family. It's and if there's questions that we need to ask, we can team up with the physicians. It's very easy, very easy.
And we can get into some more of that later, because I want people to feel comfortable to call you on that. But hey, on a little bit lighter note, I understand that your staff is wearing different color uniforms, and I thought to myself when you emailed me that, I said, what is she talking about? What is that all about?
We decided that our staff is professionals in what they do, and we wanted them to be able to show that to the community and also work on our branding so folks can learn who we are. And we've done that. Our nurses are all wearing hunter green, which is part of our logo colors. Okay. Our hospice aides are all wearing red. And can you imagine walking down the hall of a nursing home and see several
very bright colors?
Very bright colors. It helps differentiate our staff from their staff. People in the community recognize who folks are, and the staff are getting pats on the backs that they hadn't gotten before.
Well, speaking of staff, and I also want to talk about volunteers, what role do volunteers play with hospice? How important are they?
Volunteers are very important. They are the heart of what we do. We could not provide hospice services without volunteers. The number one thing they do is provide some respite time or some rest time for the caregivers of the patients that we serve. Maybe go and sit with that person for a couple of hours so that wife can run out to the grocery store and buy groceries for the family, or run to the doctor herself.
Sure.
That is the number one thing they do.
Because they say that can be a real health risk for caregivers who will not look after themselves during that period of time.
You're right, but that patient is sick 24/7. So somebody's got to be able to go run those errands and do those things for the family.
Right.
So, and sometimes the volunteers can even do that as well, maybe run by the grocery store for them. The other thing that volunteers do, we can use volunteers that are professionals. We can have physicians or nurses or whatever come and volunteer.
So anybody can volunteer. You go through a screening thing, and a training thing. Yep. We're going to put up a website in just a minute to tell you how you can volunteer. November is National Hospice Awareness Month. It doesn't matter when. Because we might replay this segment a year from now, and I just wanted everybody to know that even though November is a special month, you need to know about hospice year-round. But what's so special? What does the month mean?
It's a time to stand back and think about all the families and folks that we have served throughout the year. It's also, we put together an event called Hospice Sabbath, which is to dealing with the churches and helping the churches to remember, and because people, that's where they connect. It's just making folks aware of hospice and what we do and all those areas.
Well, you do a great job. I want to put up on screen www.mtnvalley, stands for Mountain Valley, hospice.org. Jay has it up on screen for you right now. Please, folks, 2 things. Volunteer if you can. It means a lot to people and their families. Really do that if you can. If you have any time at all to give, volunteer and get in touch with Sheila through that website.
We just want 2 hours a week.
Yeah, 2 hours a week would be fine. and she can also answer questions about what hospice care can mean for you and your family. Thank you, dear.
Thank you.
All right.